Assalamu alaikum warahmatullahi wabarakatuh. Nkwaniza lero ku programu yaffe obulamu nange Mariam Busenge wano ku Salamu TV olutimbe olw'emirembe. Ramadan Karim bannaye mwebale kusiiba basiraamu mwebale bannaye mwenna njagalako ensuso kwebaza bano babbebi abasiiba mwebale kubeera basiraamu abalungi mwebale kugumirayo. Njagala kujjukiza gwe andaba towerabira ku downloading Afro Mobile ate n'ekirala temwerabira mbu for us here to dismissing fake news. Ebiwulire ebibye bye bitambula tubagamba nedda temutambuza mawulire mabi. Leero lwaleero nkoledde wano wakati mu kibuga naye eddwaliro lino ekyenjawulo kyendabyemu bakola consultation ya bwereere. Gwe ayina omwana wo ng'akutawanya nga tomanyi ki kimuluma jangu wano ku Gombe Medical Services wano e Mengo. Omwana wo ku Monday kuva ku Saturday ku buli lwa mukaaga jangu bakebere omwana wo ku bwereere tosasula wadde 10. Naye bwe bakusanga ng'omwana wo mulwadde awo ojja kusasulayo kakasente naye naawe ayina amannya agakutawanya buli lunaku jangu bakebere amannya go ku bwereere. Olwaleero nkoze n'omuconsultant omu akolera ku ddwaliro lino agenda kwogera luzungu naye nze nja kuba mbakyusizamuko kamusabe yeeyanjule ate ne leero atubwe tugenda kwogera ku biki bye tulina okukola nga tusiiba nga tubirabidde ku sayidi y'abasawo. Omusawo omukugu akugamba atya ku kisiibo wadde kitukakatako. How are you, doctor?
Alaikum salam wa rahmatullahi ta'ala wa barakatuh.
What is your name?
My name is Muhammad Saleh Adam Muhammad Abdin. I am a physician from Sudan. I'm happy to be here with you. I'm very happy to be in Uganda, especially in Kampala. Welcome all of you, my people in Kampala and every part in Uganda. I'm a consultant of internal medicine concerning with internal diseases.
Okay.
And this is a good chance to say Ramadan Kareem.
Okay, thank you so much. That is Dr. Muhammad. Agambye ye doctor w'emibiri, he's a physician. Bano ba general doctors ajjanjaba endwadde zonna ez'omubiri. So munnaye nja kuba mbagondezaamu. Doctor, who is not supposed to fast?
Okay, this is a very good and important question, my sister, because we are faced with this question daily, and even in your local area and in the streets, you find people asking, am I going to fast? Okay, what is wrong with me? And so on. So here, I'm going to say that there are absolute conditions which are not consistent with fasting. That means if you fasted and you are having this disease, you are going to make harm for your body. And okay. Allah don't like us to harm our body, as you know, isn't it? And in the other part, there are conditions which are relative hidden for fasting. Okay?
Yeah.
So let us start with the most common conditions which are absolutely interfering with fasting. Okay. Number one, I say diabetes.
Okay.
Which is uncontrolled. Diabetes is uncontrolled sugar in the blood. Okay, and the percent of people who are having diabetes is not less; it is high. Okay. Number two, people who are having kidney disease, my sister.
Okay.
Kidney disease. For example, they have kidney failure. Some people, they reach the state of having what is called hemodialysis. Hemodialysis means they are going to clean the blood with machines, okay? And they do this twice per week. These people, they are absolutely forbidden to fast Ramadan. Okay. Number three, people who are having stroke or neurological disease, they are paralyzed, okay? They are not allowed to fast anyhow.
Okay.
And they are supposed to be on regular treatment. They are having medicine which they have to take it daily and so on. Number four, you know, there are a lot of conditions in the blood Those people who have very low concentration of blood, anemia, you know about
Yes,
anemia.
yeah, anemia.
Yes, these people with anemia, they are not allowed to fast because they are, during the 24 hours, they need to be well hydrated. They are supposed to drink a lot of water to keep their body well hydrated. In case of they fasted, okay, they are going to develop something called dehydration, that small amount of water in their body, and then they are prone to develop complications.
Okay.
They may undergo convulsions, coma, and so on.
Okay.
So, I need to say something here in this point. Some people, they go against the advice. They say, okay, I'm well, I can fast. Why? Other people are fasting. I have to fast. Wow. So they fast, especially elderly people, our grandfathers, our mothers, and so on. They say, okay, no, now I am 60, I have to fast. So they fast. When they fast, so they start to develop the complications, okay, which is not consistent with our Ramadan and with the religious. Okay, you are going to lose your health. You are going to lose something in your body. Okay, so you are going to make more harm than you are benefit. Okay, so another disease conditions which are not consistent with fasting, those people who has gastric ulcers. And it's a very common condition, my sister.
True.
Okay?
Yeah.
So, if you already have an ulcer, you call it active ulcer. You have pain, you vomit blood, you see, and you always unable to eat. This condition, especially stomach condition, is going to be worsened by fasting. We have a lot of patients with ulcer disease which are already diagnosed. We know the ulcer disease with a mean of a device called endoscopy, which is maybe supposed to be available here in our service in Gombe. Okay, we go inside your stomach, we see that the wound inside, we see the size, and we are going to treat. If you fasted Ramadan, you are going to worsen this wound. It's not going to be healed. You are going to delay the process of healing.
Yeah.
So it is better not to fast. Another disease condition. There are a lot, by the way.
Yeah,
The list is very long. Okay, people who have ulcers in the colon. This group of diseases, we call it inflammatory bowel disease. Some conditions are called Crohn's disease. You find a lot of multiple ulcers in your small intestine. Also, people have something called malabsorption syndrome, that they cannot absorb the food from the intestine. So already they are slim, they have low weight, and so on. So these people also are not allowed to fast Ramadan. Okay. Last thing, people who have complicated heart disease. For example, they have artificial valve. Okay, they have incompetent valve. They have ischemic heart disease. They have myocardial infarction. They have bad functioning muscle of the heart. For example, the heart is working with less than 30% of its normal power. This type of patients, you find them, they are congested, the circulation is not good. When they want very small steps from short distance from here to here, they develop shortness of breathing, they become weak, and so on. So these people, they have at least 3 to 4 drugs to maintain their health.
Okay.
So also these people, we advise them not to fast. Okay?
Yeah.
This is part of the conditions and the most common conditions. Okay, my sister. But on consultation, individual patient, everyone have individual condition. Okay? So we are going to modify the individual patient according to his disease condition, comorbidity, according to his status, is well controlled. So any patient with one of these or more than these diseases, he has to consult his doctor, okay,
Okay, have
to,
you
to seek
gotten
about advice.
have you gotten any complications with your patients since we started fasting?
Now, today it is the third day of Ramadan, I think. Not yet we receive patients with complications, but in the past practice, okay, we receive patients with coma, patients with hypoglycemic coma, hyperglycemic coma. They present by the end of the day of Ramadan, they present in very bad conditions. And even to treat them and to save their life, we take a lot of, we find a lot of difficulties. You put line, when you want to put a line, you don't find the line because they are very dehydrated and so on, and they are very ill, weak, they are convulsing and so on.
Okay.
So it is something we find in practice. It is present in practice.
Okay.
Yes.
Thank you so much.
Thank you, my
Omulabwaffe
sister.
omulungi ali ku Salam TV. Omusawo agambye bw'obanga olina endwadde zino wammanga tokkirizibwa kusiiba oba teyandikuwadde magezi ga kusiiba. Gwe alina sukaali oba kye tuyise diabetes, gwe alina endwadde ez'ensigo oba kidney diseases oba kidney failure oba ayinako akantu konna akeekuusa ku kulwala ensigo, ng'olina stroke oba nga wasannyalala, bw'obanga toyina musaayi gumala oba kye tuyita anemia, bw'obanga okuliridde ng'emyaka gigenze naddala egisukka mu 6, tokkirizibwa kusiiba. Bw'obanga olina ulcers obanga olina ebiwundu kuva ku mumwa paka wansi, tokkirizibwa kusiiba. Gwe ayina endwadde z'omutima, abalina pacemakers, abalina complications, temukkirizibwa kusiiba. Tugenda kutegeera okusingako abalwadde bano abandyagadde okusiiba kiki kyabasobola okubakolera. Doctor,
Yes, my sister.
I was explaining to them what you were telling them, for those who can't understand English. What would you advise these patients in case they want to fast? Because
Very
some of them do insist.
Yes.
They insist on fasting, but what advice do you have for them?
Okay. So, I thank you for this question. Okay. And I think this is a very important topic to talk about, and it is something which you find in daily life. Okay. My advice for not only these patients, but all of the population, okay, that please come for medical advice, please come for regular follow-up, please take care of your health, please, you have to listen to your doctor, please, even if in case you are not ill, you are not feeling everything, you have to have regular follow-up and your regular visit to your doctor. So my advice is that you don't know more about your body than the doctor. Okay. So please, my advice is when we say you cannot fast, please don't fast, because you are going to do things very difficult. Okay. So some diseases are silent. Some diseases are we call them silent killers. They do not present with pain, they do not present with headache, they do not present with any symptoms. These kind of diseases, you can't, as a normal person, you can't know them unless you come for a doctor and consult your doctor. We are going to check you, examine you. We are going to put the stethoscope in your body. Okay. We are going to check your blood. We are going to check your urine. We are going to make scanning. You get. Then we are, in certain cases, we give people medications which are called prophylaxis, that to prevent any event to happen. Some people say, okay, I'm all right, doctor, I'm all right. Why am going to take any medicine, like aspirin, for example, okay? So we say no. There are something inside your body which you don't know, which is very important to take for this medicine, okay? So before prevention is better than cure. Okay. So my advice for all of the population is pre-Ramadan, before Ramadan, You come and check your body. If you are all right, you are allowed to fast. If you have any disease, this is the right time to discover.
Okay. Omusawo agambye bw'obanga owulira nga teweewulira bulungi naddala ng'osiibye ng'oli ku bantu betumenyemenye waggulu, jangu olabe omusawo oba noonya omusawo akuli okumpi osobole okumunnyonnyola kikyowulira. Ayinza okugamba mira eddagala ku makya, ku ddaaku oba ku futaal, ate n'omala ng'osiibye, naye ng'olabye omusawo munaye tukwagala ng'oli mulamu. Katweyongereyo maaso. Doctor, what are some of the diseases or some of the health conditions that
Yes.
can be induced by fasting?
Very good question. Okay, so you see, fasting including you are not allowed to drink water, not allowed to eat. Okay, so the conditions are related to eating and related to drinking. So for people who cannot tolerate dehydration, that is small water in the body, okay, the diseases which can be induced by fasting, number one, and it is a very serious chronic kidney disease, renal failure. We call it renal failure. That the kidney fails to do its job. The kidney works with water. If there is very little water in your body, okay, the kidney is going to undergo shutdown, no urine output, okay, then the poison which is supposed to get out from your body by the kidney is going to accumulate inside your body, is going to cause for you renal failure.
Okay.
Number two, fasting in people who are not allowed to fast may induce to develop stroke.
Okay.
That is, you see, ischemic brain disease, ischemia, stroke, okay? Because there will be less water in your body, okay? Circulation is weak, less blood is going to your brain. Some blood vessels are going to be blocked by clotting, okay?
Yeah.
Another conditions, like if you have medicine which you are supposed to take it regularly, and you stop to take it because of fasting for more than 16 hours, you are not taking medicine. So the basic disease which you are taking medicine for it is going to be worsened. Okay? And hypoglycemia, this is the most common. This can happen even in some people who look normally, that less glucose in your body, less glucose, you are going to undergo coma. Okay? Again, we go back to ulcers. You get? People who fast, ulcer is induced by hungry, and we call it 2 o'clock night pain. Even before Ramadan, people with duodenal ulcer, they develop severe pain and they wake up at night because overnight fasting induces pain. Okay? That is it. So this gets back us to remind people that fasting is good, but for those people who are allowed to fast. And it is very bad for people with disease conditions. You are going to make harm for your body.
Yeah.
Okay? So please be adherent to your medications, be adherent with your follow-up visit, be adherent with your doctor. You ask the right person the right question. Some people, they ask their colleagues. Okay, yes.
No, they ask Google.
They ask
They go through the internet, they ask
So
and get prescriptions, go to the pharmacy, they get drugs and they do self-medication.
no, it is not right, because Google is not going to examine you. Google, yes, this is advice. This is general advice, but for the personal treatment, you need to see your doctor face to face. I need to see you. I need to examine you. Okay, there are a lot of points that cannot be picked up just by internet. Okay, you have to subject you to examination. I have to see you. Are you fat? Are you thin? Your general condition, and so on. Okay, so follow-up visit is very important.
I have a few concerns. There are people who are meant to take medicine daily. For example, people who have HIV.
Pardon?
People who have HIV.
HIV, okay.
They're supposed to take medication every day.
Yes.
Now, and the ladies, for us, we have monthly periods. Definitely, when you are in your monthly periods, you drain blood. And there are those who are heavy bleeders. They bleed a lot, like, for example, people who have adenomyosis, endometriosis, they bleed a lot. What advice do you give to such patients? Such people, they are not patients. Such people. Such people.
Okay, so we have, in medicine, generally speaking, we have cut margins for what is called severe, not severe, and it is minimum, and so on. So, this blood loss, if you have a cut margin and thresholds, if it is certain point, it is severe, to the extent that you develop anemia, you develop critical concentration of your blood. In this case, you cannot maintain your life unless you receive blood from outside. That is donation. In certain cut point, this is determined by the doctor. Okay? So, if you don't reach this critical point of low blood, you can maintain your blood with multivitamins, with good nutrition, okay, with exercise, okay, and so on, good hydration, and so on. So, the critical point is determined by the doctor and by the lab test.
Okay.
So, people who are immunocompromised, you mean people with HIV virus, they are immunocompromised. That means they have less immunity and they are subjected to a lot of minor infections, flus, chest infections, diarrhea, and so on, colds, and so on. Extremities of age also, the children and the very old people, they have weak immunity. They cannot defend the disease from their body, and these people are these are called special group of people. These are, even they need more care, more adherent to medications, to be more adherent to the medical service. Yes.
Okay, thank you so much. Omulawa from Lungi, Ali ku Salam TV. Omusawo agambye bw'obanga osiiba, bw'obanga atolidde bulungi wandifuna bino wammanga. Ensigo zo zandifunamu obuzibu kubanga tezikyasengejja, omusulo tokyafuka nnyo. Kati oyinza okwesanga nga ofunyeemu obuzibu n'ensigo zo, kye tuyita kidney failure. Oyinza ofuna stroke. Omubiri gwe bwe guba nga munafu, nga wasiibye tolidde ddaaku, tewanywedde bulungi ku makya, nekibaawo kumala akabanga, oyinza ofuna stroke nga brain yo tekya processinga mazzi gamala oba nutrients ezimala okukipinga obwongo bwo nga bukola. Oyinza okufuna kye bayita hypoglycemia oba nga tolina sukaali amala mu mubiri. So bw'obanga osiiba olina okumakinga sure mbu olya bulungi, okumakinga sure mbu tofuna bintu bino. Oyinza ofuna ulcers ng'osiiba. So okusiiba kuno kuliko ebirungi n'ebibi. Matchazi kitukakatako okusiiba, naye bw'obanga teweerabiridde bulungi wandifuna ebyo wammanga. Mubuuzizaako abantu abali ku ddagala bo bafuna batya. Bagamba kimu nti mbu olina okumira vitamins, ate abakyala bagenda mu nsonga olina okumakinga sure bw'oba ogenze mu nsonga mirayoko ku buweko obuleeta omusaayi, obalansinge bulungi, oleme okubeera nga oggwamu ate n'onywa nnyo, oleme osobole okubanga osobola okusiibirawo nga wakava mu nsonga. Ngenda kugendako mu bulango bwa bakama bange. Tova ku Salam TV, olutimbe olw'emirembe.